Evening, everybody. Mrs. Shailaja, Chandra, Dr. Rehan, other dignitaries on the chest, ladies and gentlemen, thank you very much for inviting me to speak at this prestigious forum. It's indeed an honor and a privilege to stand in front of you and try and share with you my experience of integrative medicine. I have to say my association with Ayurveda goes back to my childhood because there was an Ayurvedic medical college next to my school, and I used to jump over the fence during the recess and steal a lot of fruits from their trees. The pasting and the beating given by the Ayurvedic principal I still remember. So I went over to UK. I trained as a cardiothoracic surgeon and lived there for about 20 odd years. And I do minimal access keyhole chest surgery, which is video assisted and robotic thoracic surgery. I came back about two and a half years ago because I was smitten by the dream of Dr. Trehan, and I saw the potential of the whole place, of Medanta, the Medicity. When I came back from England, the good thing of having been abroad for 20 odd years was that I did not have any excess baggage regarding homeopathy, Unani, things. The bottom line was I didn't know anything about these specialities. So it was very easy for me to come into this setup and start doing my work. My work involves tiny cuts on the chest wall, getting into the chest, and then operating on, the structures within the chest, doing cancer work, doing other tumors and other benign diseases. The problem with the chest is that every rib has got a nerve running underneath it, and it's a sensory nerve. And even though we have done away with the big cut and we are not cutting any muscles anymore, the little cuts that we make, when they are healing, these scars start to shrink. And when they start to shrink, they start to pull on the nerve. And some patients will get a lot of pain from these tiny incisions. And that's when Dr. Geeta Krishnan came to my office and he said, I've been running this plan of integrative medicine. I've been working with the neurosurgery patients for chronic pain treatment and things like that. And, is there any way that we can apply this to your department? And I said, hallelujah, I have a set of patients. They may be a small number, but they do have pain in the chest following my surgery. And how are you going to help them? And he said, send them to me. I'll see what I can do. For me, it was very easy. It didn't cost me anything. It didn't cost the patient anything. It was very cheap. And I had nothing to lose. So he took them in. He started doing this treatment where he builds a well with a dough around these little tiny cuts and pours medicated oil onto it with all the herbs in it. So it's like a hot fermentation. And then he also has a system which is called as a Portly system, where he puts all these herbs into a packet, ties it up and heats it up in some special oil and, gives them fermentation to the chest wall. And lo and behold, my patients came back and said, you know what, doctor? A, the pain is gone. B, the guy who does it is extremely good. He's patient enough to listen to me. He talks to me nicely, as opposed to the other clinics where I'm running around like a headless chicken. And I'm feeling good. The pain's gone. The pain is gone. So, that's where the story started. And I said, that sounds very good. Why don't we take it forward? If it can work in my post-op patients, then can I integrate some of this into my pre-op patients? So I went back to Dr. Geeta. Incidentally, his office is next door to mine. So, we are always jumping into each other's office and trying to exchange ideas. And I told him, listen, Geeta, I've heard something very nice about yoga and meditation and things like that. Can you work with that? So he said, yeah, why don't we try it? See, for my patients post-operatively, the breathing is the most important thing. Because when they have pain in the chest wall, we want to take away the pain because we want them to do the deep breathing exercises so that they do not retain sputum and do not get chest infections. So we said, let's design a protocol where all my patients are seen by you preoperatively, by your team. You teach them the breathing exercises. We will do pulmonary function test. We have to document that what we are doing, is it making a difference to the patient or not? So all my patients started having preoperative pulmonary function test, hard numbers put at us, and the yoga practitioner, Dinesh is standing there, he used to go and spend time with them and teach them the breathing exercises. And as soon as they came out from the theater in the ICU, the moment they were out of the anesthesia bed, the first 3, 4, 5 hours later, Dinesh used to go and start them on doing these exercises. And because they had learned pre-operatively, it was very easy for them to do post-operatively. And we found that actually these patients did not have many chest infections. Their drains came out early. Their breathing exercise pattern was good. And the pulmonary function test showed us good numbers. So here was the first time that we were actually documenting scientifically an improvement in the outcome in patients who were having high-end surgeries. They were having robotic surgeries, video-assisted surgeries. But we were using simple Indian traditional techniques to get them to the next level. So, we have actually presented this work at the World Congress of Ayurveda and also in the Indian Congress of Cardiothoracic Surgeons. That's a bunch of skeptical people, trust me. You try and talk to them about Ayurveda and things like that. They will laugh at you. In fact, my topic was called as 200 BC to 2013 AD. An integration. So the topic was catchy, so they sat in the room and actually Geeta's presented the data and it was very well received. Suddenly the scientific community was saying, actually, we can integrate the two things together and it doesn't cost you much. And even if it doesn't work, it doesn't matter. So, what is the harm in trying? So that's where we are. We are trying to push the boundaries at every stage. My next thought process is going on is that actually you might have some drugs which might have capability of killing cancer at the point where I'm operating inside the chest. And I don't know if we'll be able to set up a protocol where we can do my high-end surgery, take away the cancers. These people will have post-operative radiotherapy, post-operative chemotherapy. Can we probably apply some of these drugs in this local area? Maybe get control of cancer? I don't know the answer, but that might be the future. So I think the journey has been really, really exciting. I think we are not yet there. We've got lots and lots of work to do, and we've got miles and miles to go before we sleep. Thank you very much.